Welcome, everyone. Thank you for being here today. I'm excited to introduce our presentation on understanding irritable bowel syndrome, or IBS. This is the first slide, so I want to briefly share what we'll be exploring together. We'll look into what IBS is, its symptoms, causes, and ways to manage it. We'll keep it informative and engaging, so let's get started. Let's take a closer look at some of the key factors involved in IBS. Inflammation, sensitivity, and hormones play a significant role in how this condition manifests and affects individuals. These elements can influence gut function and contribute to symptoms like pain, bloating, and irregular bowel movements. Moving on, stomach acid and bile flow are also crucial aspects to consider. Imbalances here can irritate the gut lining and disrupt digestion, making symptoms worse. Next, the gut microbiome, the trillions of microbes living in our digestive system, has a big impact on IBS. Changes in the microbiome can affect digestion, immune response, and even how sensitive our gut becomes to stimuli. Gut motility issues are another important piece of the puzzle. When the muscles in the gut move too quickly or too slowly, it leads to symptoms like diarrhea or constipation, which are common in IBS. Then we have the gut-brain axis, a fascinating communication system between our brain and our gut. This connection can influence how we perceive pain and regulate gut functions, linking psychological factors with physical symptoms. Finally, all these components tie back to the overall picture of IBS, highlighting how complex and multifaceted this condition really is. Understanding these interconnected factors helps us see the bigger picture and points us toward more effective management strategies. Let's start by exploring what IBS really is. IBS, or irritable bowel syndrome, is a common disorder that affects the large intestine. It's characterized by a group of symptoms, which can include stomach pain, bloating, gas, and changes in bowel habits like diarrhea or constipation. What's important to understand is that IBS doesn't cause permanent damage to the intestines or lead to more serious diseases. It's more about how the gut functions rather than structural problems. Understanding IBS is crucial because it impacts a lot of people's daily lives, often causing discomfort and anxiety. Throughout this presentation, we'll look at how it develops, how to identify it, and what management strategies can help. Recognizing these key points will help us better understand the overall picture of digestive health and how to support those affected by IBS. When we look at the key factors involved in IBS, we see that it's quite complex. It includes issues like gut-brain axis dysfunction, which means the communication between your gut and brain isn't working properly. Abnormal gut motility is another factor. Basically, how your intestines move can be irregular. Then there's gut microbiome imbalance, where the good bacteria in your gut are out of sync. Low stomach acid and low bile flow also play a role, affecting digestion and nutrient absorption. Additionally, gut inflammation, hormonal imbalances, and deficiencies in minerals or vitamins can all contribute to the condition. It's important to understand that IBS isn't a single disease. Instead, it's a functional disorder, meaning it affects how your digestion, nerves, hormones, bile, and gut microbes work together. Interestingly, there's usually no visible damage on scans, which can make it tricky to diagnose. Patients often experience discomfort and changes in bowel habits, which can significantly impact daily life. So, when we define IBS, we're talking about a condition that impacts multiple systems in the body, but without clear structural damage. It's a complex interplay of factors, and understanding these helps us approach treatment more effectively. Let's talk about some of the common symptoms of IBS. Many people experience cramping and a sense of urgency to use the bathroom. Bloating, gas, and burping are also quite typical, and they can be quite uncomfortable. Food intolerance is another common issue, meaning certain foods might trigger or worsen symptoms. You might also notice changes in bowel habits, such as diarrhea or constipation, which can really disrupt daily routines. Beyond these digestive issues, there are systemic effects to be aware of. For example, brain fog, where concentration becomes difficult, and mineral malabsorption, which can lead to deficiencies and impact overall health. These symptoms can significantly affect daily life and well-being, making it important to understand their connection to IBS. Recognizing these patterns helps us better grasp the broad impact this condition can have, both physically and mentally. Let's take a closer look at the gut-brain axis and its connection to IBS. The gut-brain axis is essentially the communication network between your gastrointestinal system and your brain. It involves a complex interplay of nerves, hormones, and the microbiota, the trillions of bacteria living in your gut. This axis is crucial because it helps regulate digestion, mood, and even your immune response. In the context of IBS, this connection can become a bit dysregulated. Stress and emotional factors can influence gut function, and conversely, gut issues can affect your mental state. This bidirectional communication explains why symptoms like pain, bloating, and irregular bowel movements are often intertwined with anxiety or stress. Understanding this axis is key because it highlights how interconnected our mind and gut really are. It also opens up potential avenues for treatment, not just targeting the gut, but also addressing psychological factors to better manage IBS symptoms. This concept ties back to the overall theme of how holistic approaches are essential in understanding and treating IBS effectively. So the gut and brain actually communicate through several important pathways. Mainly, they connect via nerves, especially the vagus nerve, which acts like a direct line between the two. In addition, neurotransmitters like serotonin play a big role. They're not just in the brain but also in the gut, helping send signals back and forth. Hormones are also part of this communication network, coordinating responses and maintaining balance. Now, if this communication axis isn't working properly, it can lead to a variety of symptoms like cramping, urgency to go to the bathroom, and even episodes of diarrhea or constipation that are triggered by stress. And it's important to note that anxiety can actually make these symptoms worse, creating a cycle that's hard to break. Understanding this gut-brain axis is fundamental because it highlights how closely our mental and digestive health are linked. When we recognize these connections, it opens the door to more holistic approaches in managing gastrointestinal issues. This is a key piece of the overall puzzle in understanding how our mind and body work together. Now let's take a closer look at how chronic stress impacts the gut-brain axis. When stress becomes ongoing or chronic, it tends to promote sympathetic dominance. That's the fight-or-flight response taking over. This shift can really disrupt gut function, making symptoms of IBS worse. Essentially, stress doesn't just affect our mind, it directly influences how our gut operates. Moving on, abnormal serotonin signaling in the gut is another key factor. Serotonin isn't just about mood. In the gut, it's crucial for regulating motility and sensation. When this signaling gets out of balance, it can contribute significantly to the discomfort and irregular bowel movements we see in IBS. Finally, dysfunction of the vagus nerve plays a big role here. The vagus nerve is like the communication highway between the brain and the gut. When it's not working properly, that communication breaks down, which again worsens IBS symptoms. So all these factors, stress, serotonin imbalance, and vagus nerve issues, are interconnected causes of gut-brain axis dysfunction. Understanding these connections helps us see why managing stress and supporting nerve health are so vital in addressing IBS. Now let's take a closer look at gut motility issues in IBS. As many of you know, IBS is a complex condition, and one of the key features involves how the gut moves. In people with IBS, we often see abnormalities in gut motility, which means the way the intestines contract and relax to push food through. These motility issues can manifest in different ways. Some individuals experience faster transit times, leading to diarrhea, while others have slowed movement, resulting in constipation. What's particularly interesting is that these irregularities in gut motility aren't just random. They're linked to the overall symptom pattern and severity in IBS patients. Understanding these motility disturbances is crucial because it helps us target treatments more effectively, whether it's medications that modulate gut movements or other therapeutic approaches. So, in the context of IBS, motility issues are a central piece of the puzzle, connecting to both the symptoms experienced and the underlying pathophysiology we've been exploring. Now, let's talk about IBS-M, which involves alternating between diarrhea and constipation, creating quite unpredictable bowel habits. You might experience periods of loose stools followed by times of difficulty passing stool, making things quite challenging to manage. This pattern can be explained by different types of gut transit. When the transit is slow, it leads to IBS-C or constipation-predominant IBS. In this case, bowel movements become infrequent, and passing stool can be quite difficult. On the other hand, when the gut transit is rapid, it results in IBS-D or diarrhea-predominant IBS. Here, you'll notice frequent, loose stools along with a sense of urgency, which can be very disruptive. Overall, what this shows us is how gut motility directly impacts the symptoms of IBS. Slow transit tends to cause constipation, while rapid transit leads to diarrhea. Understanding these patterns helps us better grasp the complex nature of IBS and tailor more effective treatments. Let's take a closer look at how thyroid and hormone issues can influence gut motility. When the thyroid is imbalanced, it can cause either constipation or diarrhea, depending on whether it's overactive or underactive. Additionally, imbalances in neurotransmitters like dopamine and acetylcholine play a significant role, as they directly affect how smoothly our intestines move. Moving on to magnesium deficiency, this mineral is crucial for normal muscle function, including the muscles in our gut. When magnesium levels are low, it can lead to abnormal gut motility, often resulting in constipation. Lastly, the nervous system itself is a key player here. Imbalances within the nervous system can disrupt the natural rhythm of gut contractions, making digestion less efficient and contributing to discomfort. All these factors, hormonal, mineral, and neural, are interconnected and highlight just how complex gut motility regulation truly is. Understanding these influences helps us better address digestive issues holistically. Now, let's take a closer look at the role of the gut microbiome in IBS. As we know, the gut microbiome refers to the trillions of microorganisms living in our digestive tracts. These tiny residents play a crucial role in maintaining our gut health and overall well-being. In the context of IBS, the balance or imbalance of these microbes can significantly influence symptoms. For example, an overgrowth of certain bacteria might contribute to bloating, gas, and discomfort. Conversely, a diverse and balanced microbiome can help regulate gut function and reduce symptoms. This connection highlights how integral our gut bacteria are to digestive health and how targeting the microbiome could be a promising approach for managing IBS. Throughout this presentation, we've seen how complex and interconnected these systems are, and the microbiome is a perfect example of that complexity. On this slide, we're looking at some common symptoms that many people with IBS experience. These include bloating after meals, which can be quite uncomfortable, as well as frequent burping and gas. You might also notice food intolerance, where certain foods seem to trigger your symptoms more than others. And an often overlooked symptom is brain fog, which can really affect your daily life and overall well-being. These symptoms are all interconnected and can significantly impact your quality of life. Understanding them is key to managing IBS effectively. Now, moving on, let's talk about the underlying issue that often causes these symptoms, what we call gut microbiome imbalance or dysbiosis. This imbalance is quite common in IBS patients. It involves several factors, including SIBO, which is an overgrowth of bacteria in the small intestine. There can also be an overgrowth of Candida, a type of yeast, and a loss of beneficial bacteria that normally help keep our gut healthy. All of these changes in the microbiome contribute to the symptoms we've just discussed. Finally, the importance of maintaining a balanced microbiome can't be overstated. When our gut bacteria are in harmony, our digestion improves, symptoms reduce, and our overall health benefits. So, addressing dysbiosis is a crucial part of managing IBS effectively and restoring quality of life. Now, let's talk about managing your gut microbiome for relief. First, dietary adjustments can play a significant role in restoring balance. I recommend focusing on fiber-rich foods, such as fruits, vegetables, and whole grains, because they help nourish the beneficial bacteria in your gut. At the same time, it's wise to limit processed items and foods high in sugar or unhealthy fats, as these can disrupt the microbial balance. Next, let's consider probiotics. These are live beneficial bacteria that, when taken appropriately, can boost your gut health. They help increase the number of good bacteria, which can improve digestion and overall gut function. However, it's important to consult with a healthcare provider before starting any probiotic supplement. They can recommend the right type and dosage tailored to your specific needs, ensuring you're taking the most effective approach for your gut health. Together, these strategies, diet improvements and probiotics, are key pieces of the puzzle in managing your gut microbiome for better relief and overall wellness. Let's take a closer look at how stomach acid, bile flow, and IBS are interconnected. Stomach acid plays a crucial role in breaking down food and protecting us from harmful bacteria, but when it's not regulated properly, it can cause discomfort. Bile flow, on the other hand, is essential for digesting fats and absorbing fat-soluble vitamins. When either of these processes is disrupted, it can lead to symptoms commonly associated with IBS, such as bloating, cramping, and irregular bowel movements. Understanding how these components work together helps us see the bigger picture of digestive health. By maintaining a balanced environment in the gut, we can better manage or even prevent some of these symptoms. This connection emphasizes how integral proper digestion is to overall well-being and highlights the importance of a comprehensive approach to treating IBS. Let's talk about the significance of stomach acid. Stress, zinc deficiency, the use of proton pump inhibitors, or simply aging can all lead to a reduction in stomach acid production. When our stomach doesn't produce enough acid, it can have a big impact on digestion and overall health. Many IBS patients actually experience low stomach acid as well, which can cause poor protein digestion. This incomplete digestion can lead to fermentation in the gut, resulting in gas, bloating, and discomfort. Additionally, low stomach acid can impair the absorption of vital minerals, which are essential for many bodily functions. So, understanding the role of stomach acid is key in managing digestive health. When acid levels are low, it sets off a chain reaction that affects digestion, comfort, and nutrient absorption. This is why it's a critical piece of the overall puzzle we're exploring in this presentation. Now, let's talk about what happens when bile production is low. When bile is insufficient, it can lead to fat intolerance, which means our body struggles to digest and absorb fats properly. You might notice pale or floating stools, or even greasy diarrhea. These are clear signs that fat isn't being processed correctly. Additionally, low bile can disrupt the balance of gut bacteria, leading to issues like candida overgrowth and small intestine bacterial overgrowth, or SIBO. Bile isn't just about digestion. It plays a crucial role as an antimicrobial agent. It helps control the growth of harmful bacteria in our gut, which is essential for maintaining overall gut health and homeostasis. Without enough bile, this control is lost, and it can create a cascade of problems. Now, what causes low bile flow? Several factors can limit bile production. Liver congestion is a big one. When the liver is overwhelmed or not functioning optimally, bile output drops. Low testosterone levels, low copper, and deficiencies in amino acids like taurine and glycine also impair bile synthesis. All of these elements are interconnected, and addressing them is key to restoring healthy bile flow. Understanding the importance of bile flow helps us see why supporting liver health and ensuring proper bile production are vital steps in maintaining overall wellness and digestive harmony. Let's take a closer look at how inflammation, sensitivity, and hormones all play a role in IBS. First, Inflammation in the gut is often present in people with IBS, which can contribute to symptoms like pain and discomfort. This inflammatory response can make the gut more sensitive to normal stimuli, leading to heightened pain perception. Sensitization is a key concept here, meaning the nerves in the gut become more responsive over time, so even minor triggers can cause significant symptoms. This increased sensitivity is a big part of why IBS can feel so unpredictable. Hormones also influence IBS symptoms, especially in women. Fluctuations in hormones like estrogen and progesterone can affect gut motility and sensitivity, which explains why some women notice their symptoms worsen during certain times in their menstrual cycle. Connecting these points to our overall theme, it's clear that IBS isn't just about the gut itself, but involves a complex interaction of immune responses, nerve sensitivity, and hormonal regulation. Understanding this interplay helps us approach treatment more holistically, targeting not just symptoms, but the underlying factors contributing to them. Now, even normal gas can feel painful under certain conditions. This is because factors like dysbiosis, food antigens, post-infection states, and NSAID use can all trigger inflammation in the gut. When inflammation occurs, it can lead to what we call visceral hypersensitivity, meaning the gut becomes more sensitive to stimuli. This heightened sensitivity is a key concept because it helps explain why some patients experience pain even when there's no obvious structural problem. It ties into the overall theme of how gut inflammation and hypersensitivity play a crucial role in functional gastrointestinal disorders. Understanding these mechanisms is essential for developing effective treatments, especially since they help us see beyond simple symptoms and recognize the complex interplay between inflammation and pain perception in the gut. Now, let's talk about the impact of hormones on our gut health. When testosterone levels are low, it can lead to decreased bile production and slower motility, which means digestion can become sluggish. Similarly, an imbalance in thyroid hormones can cause either constipation or diarrhea, disrupting the normal rhythm of our digestive system. High cortisol, often linked to stress, promotes a leaky gut, which can lead to increased inflammation and sensitivity. And when prolactin levels are elevated, they can impair gut motility, making digestion less efficient. The key takeaway here is that hormones play a crucial regulatory role. They control gut movement and sensitivity, which are vital for smooth and effective digestion. Understanding this connection helps us see how hormonal imbalances can contribute to digestive issues and highlights the importance of maintaining hormonal health for overall wellness. Let's take a closer look at mineral and vitamin deficiencies in IBS. As we know, IBS can sometimes lead to nutritional gaps because of factors like dietary restrictions or malabsorption. For instance, deficiencies in minerals such as magnesium and calcium are common, and these can impact muscle function and overall gut health. Vitamins like B12 and D are also frequently affected, which can influence energy levels and immune function. It's important to recognize these deficiencies because addressing them can help improve symptoms and overall well-being. Connecting this to our broader discussion, ensuring adequate nutrient intake is a key part of managing IBS effectively and maintaining a balanced diet. Let's talk about some common nutrient deficiencies that can impact IBS symptoms. First, vitamin B12 deficiency can lead to neuropathy and motility problems. Since B12 is vital for nerve function, its deficiency can really affect how nerves communicate and how the muscles move in the digestive tract. Moving on to copper deficiency, it can cause low bile production, anemia, and nerve issues as well. Copper plays a role in producing bile, which is essential for digestion, so lacking it can disrupt normal digestive processes. Next, magnesium deficiency often results in cramps and constipation. Magnesium is crucial for smooth muscle function, which means it helps muscles relax and contract properly in the gut. When levels are low, that balance is disrupted. Finally, zinc deficiency can lead to low stomach acid and poor healing. Zinc is necessary for producing stomach acid, so without enough, digestion can slow down, and the gut's ability to repair itself diminishes. Overall, these deficiencies, magnesium, zinc, copper, and vitamin B12, are quite common and can significantly influence IBS symptoms. Recognizing and addressing these deficiencies can be a key part of managing the condition effectively. Let's explore why IBS treatments often fail. One major reason is that IBS is a complex condition with multiple underlying factors, so a one-size-fits-all approach simply doesn't work. Many treatments target just one aspect, like diet or gut motility, but ignore others such as stress or gut-brain interactions. Additionally, individual differences mean that what works for one person may not work for another. This variability can make it challenging to find a treatment plan that's effective long-term. Another key point is that symptoms can fluctuate over time, so treatments need to be adaptable. Sometimes, the focus is too much on symptom management rather than addressing root causes, which can lead to temporary relief but not lasting solutions. Overall, understanding these reasons helps us see why a more personalized, comprehensive approach is essential for successful IBS management. Let's take a closer look at the overview of treatment failure. It's important to avoid solutions that might only temporarily relieve current symptoms, but could lead to bigger issues down the road. Many treatments for IBS focus on suppressing symptoms rather than addressing the underlying cause. While that might provide some immediate relief, it can sometimes cause more damage in the long run. This is what we mean by symptom suppression, quick fixes that don't solve the root problem. And over time, this approach can actually make the situation worse, leading to additional complications. So, when considering treatments, we need to think beyond just masking symptoms and aim for solutions that target the underlying causes to ensure sustainable health. Let's talk about some of the treatments that often don't work as well as we hope. First up, psychiatric medications like SSRIs and TCAs. These drugs can alter gut serotonin levels, which might seem helpful at first, but they actually only mask the pain rather than addressing the root cause. Plus, they can disrupt gut motility, leading to a range of side effects that can make symptoms worse over time. Then we have proton pump inhibitors, or PPIs. While they're commonly used for acid reflux, they can actually worsen conditions like SIBO and candida overgrowth. This happens because PPIs reduce the absorption of essential nutrients such as zinc, iron, magnesium, and vitamin B12. When these nutrients are diminished, bile signaling can also be impaired, which further complicates gut health. Understanding these limitations helps us see why relying solely on these treatments might not be the best approach, and underscores the importance of seeking more targeted, holistic solutions for gut health. So, to wrap up, when it comes to managing IBS, a holistic approach is really key. It's not just about treating symptoms in isolation, but understanding the whole person. Lifestyle, diet, stress levels, and even psychological factors all play a role. By integrating these different aspects, we can develop more effective, personalized strategies that address the root causes rather than just the symptoms. This approach helps us improve patients, quality of life, and promotes better long-term outcomes. Ultimately, considering the full picture aligns perfectly with the overall theme of this presentation, emphasizing comprehensive care for complex conditions like IBS. Let's take a closer look at the holistic approach to managing IBS. As we've discussed, IBS is a complex condition with multiple underlying causes. These include issues with the gut-brain axis, imbalances in the microbiome, and problems with motility. Because of this complexity, a one-size-fits-all solution simply doesn't work. Instead, we need a comprehensive strategy that considers all these factors. A holistic approach emphasizes the importance of diet, lifestyle, and personalized treatment plans. By tailoring interventions to each individual's unique situation, we can improve outcomes and help manage symptoms more effectively. To summarize the key points, understanding the diverse causes of IBS is essential, and managing it requires a multifaceted approach. Focusing on diet, lifestyle, and personalized care is the best way to address this condition holistically. This aligns with our overall goal of providing more effective, patient-centered management strategies. Looking ahead, I want to talk about the future outlook for managing IBS. First, seeking medical advice is really a crucial step. It's important to consult with a healthcare professional who can provide an accurate diagnosis and help tailor a treatment plan specific to your needs. With proper management, many individuals are able to improve their quality of life significantly and find relief from symptoms. Remember, the path to relief involves understanding your condition and working closely with your provider. By doing so, you can take proactive steps towards better gut health and overall well-being. This ties back to the overall theme of the presentation, empowering yourself with knowledge and support to manage IBS effectively. Thank you for listening. I hope this presentation has given you a clear understanding of the key points we've covered. Remember, the main takeaway is how important it is to apply these concepts thoughtfully in your own work. We've explored the challenges, the strategies, and the benefits of implementing these ideas effectively. Connecting everything back to the overall theme, it's about continuous improvement and adapting to change. I appreciate your time and attention, and I encourage you to take these insights forward in your projects. Thank you once again.